There's a lot going on. I mean, people are scared. There's a lot of news that's been coming out today that I think is going to have a big economic impact. But you're sitting kind of close to me, so I want to ask you: have you been tested for coronavirus?
I have not. I don't have any symptoms, and that's probably one of the biggest things that we all need to stress when we talk to folks that are concerned. Fever is going to be the first major indicator that you have something to worry about. If you've got a temperature, maybe you need to start taking things a little more seriously, and definitely considering the 14-day quarantine.
Sure. Testing has been, on our Facebook page, on everywhere you go, testing is the number one concern people seem to have. They're concerned that they see that there aren't cases, haven't been very many cases in the Panhandle, and so they're concerned that the reason that you're not seeing very many cases is because there's not been any testing. Can you speak to that at all in terms of how the state's doing testing-wise?
Sure. Well, one thing that takes place when the state does have a case, they'll go through the testing part, but there's also doing the whole history of travel of that individual, and there's traffic patterns in the state. So when you look at major cruise ports, one of the reasons why there's a spike in Broward County, Fort Lauderdale, is because you had a cruise ship unload there. The cruise ship had a number of individuals that tested positive, so that puts an abnormal spike in the number of cases there. As you have other individuals that have a history of crossing paths in a Seattle, a New York, an Asia, a China, there's definitely going to be a higher probability, and then they start building out the details of where they have the cases that they need to go and actually go through the second and third level details of inspection if they have coronavirus.
Thanks, Jimmy. I just want to tell our audience, we talked to the health department today, so we have a new story on the website that talks about who gets tested, kind of what you're talking about, why you get tested, when that happens. They've confirmed that they are testing in Bay County. The Florida Department of Health in Bay County has confirmed that. Again, they've already confirmed it before this, and they confirmed that how the screening happens. I'm sorry. Sure. The screening has to do with, again, like you're saying, you have symptoms, you have fever, you have cough, you have I think fatigue is maybe day two, and then they don't do the test necessarily unless they also can sort of confirm that you've been around other people or you've traveled or those kinds of things that would have brought you in contact with coronavirus. Is that kind of accurate?
Yeah, and so this is where you've heard the analogy being used called flatten the curve. So this is exactly what we're dealing with right now. You don't want to inundate our emergency rooms with every single individual that could have flu-like symptoms. With an overwhelming response of those type of cases that hit our emergency rooms, and eventually you might have a situation where our doctors, our nurses, our other first responders are then potentially at risk of having other ailments that keep and prohibit them from being able to do their job. So, thank God our first responders sign up for the job that they do. We've been all over the state meeting with our first responders, making sure they have their pandemic guides in hand, that they understand what they're up against. Because for some parts of the state and a lot of state government, we're in uncharted waters. We've never been in a situation where we're contemplating shutting down every state office in the state. We're figuring out ways how to do all of your state's business remotely from home. So all this is again, in precaution to ensure that lives are not at risk.
Yeah, this is brand new territory for us. So the governor today announced some new rules regarding restaurants, regarding travel. He's ordering, I believe, the closure of bars and nightclubs for 30 days. Talk about what that is and what that means and how that's going to work.
Sure. So there's definitely a concern that where you have individuals in close proximity, the president's come out and it's gone from 50 to 25 to basically about 10, trying to eliminate gatherings of people that could ultimately spread. And you think of what was a kind of a shock to folks when they shut down sporting events. You shut down a basketball tournament like the March Madness, but if one person has got tested positive in an arena, and then you think about maybe 10 or 15 people that come in contact, how that exponentially goes, and that 10 or 15 touches another 10 or 15. But you go and you put it in a closed environment like an arena, you literally could have a catastrophic event, a chain event. So this is where, much smaller, but more common are bars and nightclubs with individuals being in close proximity. This is where the governor is going with that, support where he has to make those decisions. He wants restaurants to, keep a minimum space. When we started, my family at Captain Anderson's, we started doing every other table at the restaurant a few nights ago, just to go ahead and take that extra precaution. All of our employees, making sure they're not showing up at work if they've got any symptoms of any sort, any type of flu. So these are just all precautionary measures to try to flatten the curve.
Sure, and you're a restaurant owner, and they've sort of announced this new screening for employees. How's that going to work at Captain Anderson's, and how are you going to sort of make that happen?
Well, so I mean, contrary to what most people think, I'm not at the restaurant anymore. But I still try to stay in tune with the business that I was in for the last 30 years. So I mean, if I know Yanni and Theo and Nick, right, they're getting above the curve and ahead of the curve on this to ensure that whatever we're doing is in the best interest of our employees. And if that ultimately means that we have a situation where we just do only takeout orders only, then we'll do that. But employees are not going to be allowed to come to work if they're feeling ill. They just need to stay and take time and quarantine at the house for the next 14 days.
All right. I wanted to go back to testing for a second. Does the state have enough tests? I mean, what's the sort of latest on getting enough tests and having enough tests for what they need?
So, I mean, as the tests are starting to get deployed out, I guess one of the concerns people have is I've been tested and I haven't got my results back yet. The technology that the president and his staff had spoke at the press conference the other day is best case scenario. They may have the technology rolled out with this new Roche model that's 24 hours in best case scenario. So again, I think as they are able to tighten up in delivery of this, I mean, you try to get the equipment and the necessary expertise out as quick as you can. But then, by all means, we just sent out a scam alert earlier today. Anything that sounds too good to be true that you see on Facebook or internet or Twitter or through an email propaganda that says this is online testing or you buy your test online is what I meant to say. If it sounds too good to be true, it is. I mean, heck, Jim Baker was selling type of silver elixir for $45 a bottle that people were buying that this was going to be their cure-all, protect-all, and it's a shame that people are being taken advantage of by actions like that.
I bought two. You're telling me they're not going to work?
Yeah, don't do that, dude.
Okay.
There's no telling what's in there, and it's probably not in the best interest of you to experiment.
All right. Well, and yeah, I mean, that's so important. And I know you're kind of a guy. I've written about scams for years.
Mm-hmm.
People will take any opportunity, whether it's a hurricane or now a pandemic, to try and steal money from people.
Sure.
It's just sad.
So, and a little bit of a segue is, we're in the middle of spring break. There's, in many parts of the southeast United States, this is the week that schools decide to take off for spring break. In addition, all now schools in the state of Florida will be closed next week. So you had folks that built travel plans, the airlines, the cruise lines, the hotels. They've been pretty accommodating with refunding of people's money or issuing them some type of a voucher for credit. Those that have used travel insurance, if you have any problems with that travel insurance policy, you should give us a call. That's 1-877-MY-FLCFO. We are handling those claims through our Consumer Services division, helping folks navigate it and really putting extra pressure on those policy underwriters that they need to be very liberal in their interpretations of these policies as individuals bought this because their travel was going to be interrupted. And we have got a set of circumstances that has definitely interrupted their travel. Yeah,
I mean, there's just, again, there's so much going on right now. You're talking about beaches, and I think the governor's latest recommendation is no more than, say, 10 people on the beach at a time. I'm not sure how that gets enforced, and I'm also, there have been calls from some people that Florida just needs to close its beaches altogether. We saw, I think, some video our sister station FLA did, and they were talking, and they showed Clearwater Beach, and
Clearwater Beach, sure.
there was all of these people on the beach. They're all together. Exactly what you guys have at the state level been asking people not to do. So, I mean, what's the situation there?
So, I mean, I guess again, you've got air traffic has been canceled or curtailed, so you still have those individuals that are vacationing that feel like they're symptom free, and they're going to take advantage of their vacation. They've been planning for it. They've been looking forward to it. And unfortunately, as we start to see more and more, expectations rolled out from a state level to try to take in consideration people's safety, you're going to get to the point where we'll have, unfortunately, law enforcement will have to roll out and have to play a larger role in this. And it's what I've asked, people that are dealing with first responders. Our first responders are doing their jobs. They're just, doing what's asked of them. Be cooperative. Little things like washing your hands on a regular basis. Don't do any unnecessary touching. Observe the social distancing model of 6 feet. All those things are just going to help, flatten the curve. We get through this 2 weeks. Hopefully we knock this thing down where, we get into a little warmer weather, and warmer weather is good for the human body and bad for viruses.
Yeah. As we move forward with this, there's certainly going to be a financial impact for employees at restaurants, for employees at bars, for employees in a lot of different industries. Tourism is a big industry in Panama City Beach. That seems like if it's not taken a hit yet, it's going to take a hit pretty hard pretty soon. What can be done on the state level to deal with that, and then what do you think needs to be done maybe at the national level?
So the legislative session will wrap up this week. They did have to have a small extension. The legislature had to reprioritize a number of their legislative initiatives they were trying to fulfill, and coronavirus has definitely changed the direction that the state has had to prioritize their dollars. We've put an additional $300 million set aside to deal with coronavirus related losses. We're going to see a downtick in states' sales tax collections. $90 billion a year is spent by tourists in this state, and the state of Florida collects a sales tax on all those expenditures. So as you're seeing those dollars are taking their tolls, and you think of all the ripple effects that has of every employee that's in the service industry. They buy their groceries, they pay sales tax. Every employee at Publix that stocks the shelves that the employee from the service industry is buying their groceries from, they get a paycheck, they get sales tax when they make their purchases. So tourism is just the bread and butter for the state, and the downturn of that revenue, this is why we had to make those preparations in this past legislative budget, and we'll be prepared to go back and make more changes if need be, if it's prolonged much longer than into the summer.
All right. Let's talk for a minute about hospitals. You talked about flattening the curve, and the issue is sort of we don't want hospitals overrun. What's the state doing now to sort of make sure there's enough capacity at our hospitals, make sure there's enough ventilators, I think, the equipment that hospital workers need to save lives? Well,
again, and this is where, the president was just speaking just a bit ago of more, MASH-like, tent systems. And really for Bay County, this is what we just went through with Hurricane Michael. We had both Bay Medical and Gulf Coast were doing a lot of, triaging and dealing of patients in the parking lots of the hospitals, working out of tents. So it's not an anomaly to Northwest Florida. We just recently went through it. The challenge is going to be able to get enough of those type of receiving areas with the appropriate equipment to accommodate the entire, United States if the curve does not get flattened. So again, if we are taking care of ourselves in a manner that we're being recommended to observe, you're not going to put the extra strain on our emergency rooms that we fear.
All right. Your role as state fire marshal, I know that you're very serious about that role, and you care about the firefighters that you sort of oversee. What are we doing for them right now and other first responders?
So the firefighters, it's a special breed of person that wants to be a first responder. They will always rush in while everybody else is rushing out. Whenever you dial 911, they show up no matter what the circumstances are in order to deal with whatever emergency that you're being faced with. They've got skills and expertise that they have been trained for in dealing with pandemics and dealing with fires, dealing with any type of emergency you can imagine. But they're also human beings. They have families that they like to spend time with. They go to our churches. Their kids go to our schools. They're part of our community. And saying that, the stress that is being placed on that profession dealing with this, because it's a little bit harder for them to say, I need you to self-quarantine. But what you do see happen is, a lot of our, you typically have an engine crew that shows up to a call that could be a 911, say it's a cardiac-related issue. Instead of sending, six into the building, maybe we only send 2. We'll start to be a little more sensitive to the number of individuals actually get deployed out on a call to ensure that we don't lose the entire ability to have an engine or a strike force in play. So, some precaution. And this is, again, why we talk, why we ask, why we want to make sure our firefighters, our fire chiefs, our special districts, all of them realize that the state here of Florida is there to help. And sometimes, they need to be, shown some appreciation.
Sure. Do we have enough protective gear for those guys? Are we getting more sort of the masks and things that they need to sort of protect them if they have to go get somebody who needs to go to a hospital or go somewhere?
Well, and that's exactly what the president was speaking to today, and the vice president was asking if you do have these specific types of masks, and you're in the construction industry, you're probably got an opportunity to donate excess that you've got back to local law enforcement agencies, fire departments. Do so. That at least doesn't put as much stress on. But you think about it when a team of paramedics arrives at the house. Typically they'll go through the symptoms that could be of concern, and then the first thing they're going to do is they're going to put a mask actually on you, the person they're checked in on, because if you do have symptoms that are of a concern, what they don't want to do is they don't want you spreading, those potential contaminants of the virus to anybody else that's trying to provide treatment. Say that individual ultimately ends up in an ambulance. That ambulance then transports you to a hospital if need be in order to receive the treatment. Well, now you think about that ambulance now has been contaminated, so it's got to be pulled offline for approximately about 30 minutes, and they'll bring in a piece of equipment to literally sanitize the engine so it can get back out, the buggy, so it can get back out and get back to work. So all that has been taken in consideration. They're prepared for it. But again, if you're doing what we ask you to do, you're putting a whole lot less stress on the system and delivering those necessary life-saving procedures that these men and women thankfully answer the call to take up. As we've entered this sort of new world of social distancing and sort of staying put at home, spring break has now become sort of a 2-week spring break, and it looks like it could last longer than that. Some school districts, colleges, and things like that are looking at going to online, doing other things. What's the length of time you think we're maybe looking at sort of doing this for? So, different areas of the states are taking different precautions. In New York City, they're going into, I believe, April 30th before they're going to release school. But one of the side effects from all of this that's taking place is you're seeing more and more forced implementation of distance learning. I spoke to my first class of students today using Zoom. It's a group of law students at Florida State, and it was interesting. I've never done that before, but the technology's there where you're able to remotely, educate, students that are looking at pursuing their education. At the same time, they're able to engage in a way, in a manner of throwing questions at you. You're able to answer, from the comfort of your own home. So I think what you'll see is, as this technology seems to be working, you'll probably see it more embraced just across the board. And I've always been an advocate where we can conduct meetings that can be conducted, even if for just informational purposes, where we can leverage technology. We should.
Yeah, we have sort of lived in an age where we had this technology, we could do these things, but we still wanted to all go into an office,
Sure.
or our employers wanted us to all be in an office together. We have meetings at the town square, and maybe this is a new world. We don't need to do those sorts of things. As a employer, you're talking about, shutting down some sort of state offices and things like that, and people more working from home. We're encouraging that just everywhere now, right?
Yeah, so I think state government has got to be responsive back to the citizens of the state of Florida 24/7, 365. If I didn't feel strongly about that, I shouldn't have signed up for the job, but I do feel very strongly about that, as there are needs that people are going to have that will arise, and we just have to respond. So we will learn. We will learn how to adapt. And as we adapt, we take a lot of notes, because it's probably not the last time something of this nature is going to throw our ability to deliver services back to the citizens that we get to represent. We'll need to have this attention. So we'll flex, but I ask people to have patience. This is not something that we're doing on purpose to you. We're not trying to make your life more difficult. And I've told folks, as long as if you're in the business of providing a service, if you're in the business of trying to, accept currency for a purchase, make sure you're sharing with that consumer, some of the adversity you're going through right now. Supplies are limited. I'm short-handed. As long as we're communicating, the outburst, the upset, the hard feelings, can be hopefully a little bit subsided, because we're all in this together. Nobody wishes this on anybody, and I promise you, nobody asked for this to happen.
Sure, absolutely not. People are, because they're scared, I think there's a lot of talk of things that hoaxes and scams and those kinds of things. People are worried about. Are we gonna shut the highways down and sort of force people to stay in place? Has there been any talk about anything like that?
There's definitely the hoaxes are out there, and the scams that are out there. We've been sending out constant alerts, and look, social media is an amazing way to share concerns and hopefully empower our consumers to be protected. What we're doing right now is on your Facebook page, and it's a different way of communicating. Not only is it available on somebody's iPad, it's on their phone. It can be later seen on their television. All those are just great ways to help inform the consumer of the threats that are out there that are trying to get in between them and their dollars. So again, I think there's going to be there'll be a spike in to-go orders. There'll be a convenience factor. Right now, I saw where Uber Eats is now, with their relationships with independent restaurants, they're waiving all fees. So there's going to be innovation that will come from all this. And as you look at what all the cellular companies are doing, Verizon, AT&T, Sprint, Comcast, all of which are waiving late fees. American Express waiving late fees. Your credit card companies will be waiving late fees because people are stressed out. They're overwhelmed. Data caps are being removed. So you know what? Stream to your heart's content. You're probably going to get a little bored because you're going to watch the same things on Netflix over and over and over. But again, I think the fact that you've got the public sector, the private sector coming out to assist our citizens is a great thing. We'll all learn from this, and hopefully we'll get along a little bit better from it all, too.
I think another concern I keep hearing as we're talking about sort of hoaxes is that the grocery lines, the supply lines, getting food to the grocery stores. There's not been any real concern that you've heard about that's not going to keep happening and continuing, right?
Well, so, Publix and Winn-Dixie and Walmart, they've all changed their hours of operation. And again, this is more innovation that has come out in order to help try to allow those suppliers to catch their wind. I thought it was a great idea. Chris Latval, I saw posted on Facebook earlier today. He's a House member out of Pinellas County there in the Tampa Bay area, that, we should have senior hours. So, hours of operations at our grocery stores, maybe from, 9 to 10 or something like that, where you're allowing those that could be more susceptible to, having challenges when dealing with any type of flu symptoms, that they could go and participate, get their groceries, where they're not competing against, just an all for all. I'm losing my train of thought, but free for all.
Free for all. Yeah.
I'm just, it's been a long day.
Yeah.
But a free-for-all of fighting for things like toilet paper. Who'd have thought we'd have been fighting over toilet paper the way we are? But again, allowing those seniors to be able to shop with a little bit of a respect to what they deserve, and then having normal hours of operation after that.
Finally, you've got two rambunctious boys, right? Is that an accurate description of your sons?
Yeah.
One of them made a cameo earlier. Yeah, there he is.
Yeah, there's Johnny. Can you see yourself? No,
Yeah.
you're right in front of the microphone. There's Johnny. Yeah,
So-
there he is.
So
how
he's
are
being
you?
very
patient.
He is. He's done very well. We appreciate him. How are you entertaining them with school out?
They're fortunately they're just going with me wherever I need to go. And what we're also doing, I've told my office, we're doing a rotation shifts at the office. I've told my employees, look, if you've got kids and we've got an obligation to serve citizens of the state. If you need to bring your kids to work with you, please do. It is by all means. We've got work to do, but at the same time, you've got a family to raise, and we're all in this together. So again, Johnny goes with me where I need to go. Sometimes I got one of them, sometimes I got both of them. They'll both be with me in Tallahassee the rest of this week because you know what? I need to allow my wife to be able to do some work also. So it's again all in it together. Just asking everybody for some patience.
All right. Well, last question: is there anything else you want the public to know and be aware of? Anything you really want to stress to the public
Sure.
right now?
Please check out our website. It's myfloridacfo.com. We've got a hyperlink on there that we're constantly updating with all the latest information dealing with COVID-19, the coronavirus. If you've got any questions regarding your insurance claims process, please give us a call at 1-877-MY-FLCFO. All those numbers, we're trying to do everything we can to help folks through a difficult time. And we're not opposed to even seeing if there's suggestions that you want to make. We'll go out and advocate for those. Again, this is uncharted waters. You can follow me at Jimmy Patronis at Twitter. I'm on Facebook also. Reach out to me. Let me know how I can help you deal with whatever challenges you're dealing with. And if I don't know the answer, hopefully I'll help you find the answer. But
right.
y'all, please take care and wash your hands. Don't hug each other.
Mr. Patronis, thank you so much. Thank you guys for joining us. Again, we're gonna have all of this. If you're just joining us and you missed a lot of this, we'll have it all on our website and on our My Panhandle app just as soon as we can get it ready for you. So thank you very much.
See you. Happy St. Patrick's Day.
Thank you.